Just ligament.
So ligament tests, but then ligament kind of mobilisation as well. So test sacral tuberal, okay? And sacral tuberal, okay, the best test for it is a straight leg lift, okay? And you'll find, okay, if you get your client, just come and stand up for me. You need to get your client so that he can just, did you do this on yours? Yeah, you did it, okay. So by doing this, okay, just get your client to do a straight leg lift, okay, and it doesn't matter. So if you go for your left leg first, so just stabilise yourself on the bench, straight leg lift, okay, and as they do that, if they buckle their standing leg, it's a good indicator that sacral tuberal is tight, okay, because if you imagine what's happening is we're stretching out these muscles posterior to the leg, okay, the sacral tuberal is tight, so what it ends up doing is just throwing you off balance, okay, and the only way of actually correcting that is to buckle your knee, okay. I would say, and rail vouch for it on the course, at least 75% of the course would be doing this. Yeah? Doing the John Cleese impression as they're going down. Yeah? It's difficult to mobilise in that position, okay. I would certainly encourage you to almost get into some frictions in it. Okay, and frictions for it, if you come face down, right? Frictions for sacral tuberal, okay? Release off the glutes, yeah, so try and soften them as much as possible because sacral tuberal lie below glutes, okay, so you've got to get working. So lots of petrissage, yeah, you might have done a little bit of fascial, try and correct like the pelvis position as well, okay? And then work from the opposite side. And if you work down from effectively the SI joint, yeah, and then just come off the coccyx and the sacrum and sink down, yeah? And you sink down, and as you sink down, you will move the glutes out of the way, or they will certainly have a tendency to shift away, yeah? You're obviously not going to detach them, okay, but you're obviously going to push them and ease them away. Once you've done that, you want to start frictioning up and down.
Andy's favourite.
Okay? Yeah. Okay, unfortunately we can't do the old rhomboid job and get that kind of movement, okay? So it's only ever going to be fingertips. There won't be any scope to even really get the pads of your fingers. You won't be able to move the glutes far enough out of the way, okay? But you can get just down this area of sacral tuberal, okay? And you know the nature of these ligaments are, it's where the attachments happen, that quite often you get those restrictions. So it might be that you just hit the nail on the head with that. Okay. And you can just work down, okay, not too far short of the ischial tuberosity as you work down. Yeah. Really, really effective to do. And certainly if you just add that into your special tests, yeah, just do a quick one at the end. Once you've done kind of like your Trendelenburg test or your Stork test, okay, they're already in a position, okay, just do a straight leg raise and just see whether sacral tuberal is tight. Yeah? Okay, so let's go for what position are we in? Okay, so if we go for iliofemoral, okay, so iliofemoral inhibits adduction and extension of the hip. Okay, so effectively all we're going to do is put it in that position, abduction and extension of the hip. Abduction. Okay, so kind of bend the knee, stabilise the pelvis, okay, abduct it around about 30 degrees, okay, and then we literally bring it up, okay. Now if they were saying at that stage, yeah, that's really uncomfortable, okay, yes it might be, so yes it might be kind of slightly leg bend, but it might also be something like iliofemoral at the front, okay. If that's the case, just doing some mobilisations, grade 4 mobilisations effectively, yeah, just working in that end range can be really beneficial. Okay. Flick onto your back, Ray. So that's iliofemoral. Pubofemoral, okay, probably the least effective. Least effective because it's the hardest to isolate, okay. It basically just limits extension of the hip, okay. So the way in which we would mobilise it is just going into that position, okay, but we know that that could be a lot of musculature that would be identifiable for that as well. But it's still worth doing some mobs in that end range, okay? worst it's going to be is feel reasonably relieving for kind of muscle there. Probably the most effective one is ischiofemoral, and conveniently it's the one that tends to be most of the issue because it's got the most weight bearing capacity down the back. Okay. For ischiofemoral, okay, it's limited by flexion, adduction, and medial rotation. Okay, so that's my idea. Okay, flexion, adduction, and medial rotation. Okay, or internal rotation, whatever terminology you use. Okay, so we need to put it into that position. Okay, and mobilise it. Okay, so flexion, abduction, medial rotation, and just right. Okay, just going to ease through. Okay. Now that is definitely worth on Ray comparing on one side to the other.
The only action you were doing there was
Pretty
doing
much the
more
last one.
medial rotation.
More medial rotation, because I'm kind of putting it in almost like a mid-range of them. And if I thought he was fine with that, I might push it into a little bit more flexion and a little bit more adduction, okay, and then work on that medial. But it's going to be that last bit which puts the stress on the ligament itself, because there to there, I'm not even using the ligament. Well, I'll be using part of it, but there's other ones kicking in. But it's that last little bit where it just isolates that in particular. Okay.
And if there's no medial rotation?
As in no medial rotation, they need really working. That's why you were smiling, wasn't it?
So that's like the start of the correction for leg length discrepancy. So would you wind that hip round if you've not got any of that medial? Would you wind the hip round a couple of times first?
Yeah,
to loosen
definitely.
it
Yeah,
off?
and there are other. I mean, there's a whole host of kind of sort of like tests as well. But there's things like, if you've heard of the SCAR test and the hip distraction, and those ones are very much kind of sort of like just working in there and literally just mobilising in that area, just to kind of sort of work it around and sort of like, you know, that's typical for like the SCAR test, working through there, and that will pick up all kinds of restrictions, even stuff like osteoporosis, you know, and you can combine that with a bit of a distraction to try and isolate different conditions. But yeah, that one, I would say those ligaments are, you know, are actually involved in a lot more than kind of really kind of attributed things to at this stage in your learning. Because at the moment, kind of when you've gone through joint assessment, you're identifying muscles, yeah, and then you work on the muscles. But what if it is, you know, a restriction on that rope-like structure just between it? What tools? You can't friction in there. You just can't get to it. Okay, so it's got to be mobilisations. Okay, and those mobilisations, yeah, yes, your normal passive physiological and other movements will help, but these ones will just really isolate them. Okay.
What about persistent groin strain? Some people seem to be really susceptible to.
So I find that pelvis kind of positioning has a big play in that. Trigger points as well, but mobilisations around it, so just the typical kind of passive physiological kind of like sitting there, legs out, yeah, and just working down, NETs on them as well. Yeah, sometimes it is just a case of being, you know, really persistent and persevering through it, and knowing that, okay, it might take a few sessions to work this out. Yeah, but always integrating as many techniques as you can, because it might be that you open up, you know, it might be that you trigger point in there and there's nothing in there. Yeah, so you do some NETs and you do some mobilisations, and then the next thing you know, you go through again and there's a big fat trigger point in there, you know, and everything else was just effectively hiding it. Yeah. Just be persistent, but it's, you know, you don't always try and think there's a right option to do something. It's just working through the techniques you've got at your disposal. Okay, so they were kind of added extras for you. Okay. In terms of the mobilisations themselves, what have I got? I've got all the
Got all the glides.
Okay, so